Communications Officer for the Oregon Health Authority Public Health Division. This is a press conference to provide you an update on Oregon's response to the outbreak of novel coronavirus, COVID-19. We will start with remarks by Governor Kate Brown, Oregon Health Authority Director Patrick Allen, and Dr. Dana Harganani, OHA Chief Medical Officer. We also have other OHA representatives on hand, including Dr. Paul Cieslak, Medical Director for Communicable Diseases and Immunizations, and current Senior Health Advisor on OHA's COVID-19 response. We have Dr. John Fontana, Director of the Oregon State Public Health Laboratory. In addition, we have senior representatives of the 3 counties that are reporting new cases today, including Dr. Bob Dannenhofer, Administrator and Health Officer, Douglas County Public Health, Dr. Christina Baumann, Deputy Health Officer, Washington County Public Health, and Katrina Rothenberger, Director of Marion County Public Health Division. After remarks are complete, we will open it up to questions. Those reporters watching the live stream can send follow-up questions after the press conference to phd.communications@state.or.us. Also, those watching the live stream may not be able to hear the questions being asked, so I would just ask our speakers to try to repeat the questions before responding. With that, I will turn it over to Governor Kate Brown.
Thank you and good morning. I appreciate you all being here this early on a Sunday morning. 9 days ago, I announced we had Oregon's first case of COVID-19 coronavirus. Late yesterday evening, we learned of 7 new cases in Oregon, bringing the total number of cases in our state to 14. First, my thoughts and prayers are with these Oregonians and their families. I understand that this news is very concerning. As your governor, I want to reiterate how seriously we are taking this situation. I have consulted with the Oregon Health Authority, and I am declaring a state of emergency to ensure that we are able to swiftly deploy the personnel and resources necessary to address coronavirus in Oregon. This emergency declaration gives the Oregon Health Authority and the Office of Emergency Management all the resources at our state's disposal to stem the spread of this disease. Specifically, it activates Oregon's reserves of emergency volunteer healthcare professionals. This is particularly important because of the cases identified in rural Oregon. It unlocks valuable support to help local public health authorities. Additionally, the declaration grants broad authority to the State Public Health Director, to OHA, and to the Office of Emergency Management to take immediate action and devote all available state resources toward containing this disease. When the first case hit in Oregon, our teams were ready to quickly identify and monitor those impacted. We also investigated others that may have come into contact with the individual. It is through these preparedness and response efforts that health officials are identifying and monitoring new cases. The situation is evolving here in Oregon and, of course, across the entire globe. I understand that it can be scary to hear news of fellow Oregonians coming down with the coronavirus. I have directed the Oregon Health Authority to consistently disclose information on positive cases moving forward, including age ranges statewide, and cases by county where individuals with the coronaviruses are located. I can also assure you that local and state health officials are working around the clock to address this crisis. They are trained professionals who are putting your health and safety first. Additionally, I am in constant contact with our congressional delegation and others at the federal level to ensure Oregon is receiving the attention and resources we need from them on this issue. We will do everything in our power to keep Oregonians safe. This state of emergency will remain in effect for 60 days. It can be extended until the public health threat of the virus is contained. With that, I will invite OHA Director Pat Allen to give more specifics about the new cases and to share next steps in our response efforts. Thank you very much. Pat?
Thank you, Governor. Today, what I'd like to do is give you a brief summary of the latest information we know about COVID-19 and tell you how we intend to use the powers under Governor Brown's emergency order to mobilize Oregonians in an unprecedented state and private effort to contain the spread of COVID-19 in Oregon by focusing on specific at-risk populations, protect Oregonians at greatest risk of the most severe outcomes of this disease, older adults, people with underlying conditions, and the homeless and people who are vulnerable in other ways, and respond with fast, targeted, and effective measures to safeguard our state against widespread illness and disruption in the face of a growing outbreak. Yesterday, the Federal Centers for Disease Control and Prevention issued guidance that identified older adults and those with underlying health conditions as being the population at greatest risk. Our strategy is based on the emerging science and the risks identified by our federal partners. As I've been saying throughout, the time to declare an emergency is when we need the tools that an emergency declaration provides to protect Oregonians most at risk. As Governor Brown told you, the COVID-19 outbreak continues to expand in Oregon. Many Oregonians are wondering, will COVID-19 appear in my community? Will it affect my family, friends, and other people I care about? Could I get COVID-19? I understand these worries. Oregon public health experts and healthcare providers are learning more about COVID-19 every day. We're working closely with healthcare providers and local public health officials to test and treat patients, identify people at risk, and keep you informed so you can protect yourself and your loved ones, and help us stem the spread of COVID-19 in our state. What we know: the Oregon Health Authority has confirmed 7 new presumptive cases of novel coronavirus resulting in the disease COVID-19, bringing the state's total number of those who've tested positive to the virus to 14. The 7 new cases are located, 1 in Douglas County, 1 in Marion County, and 5 in Washington County. The cases include a mix of community spread and spread related to contact with a previous case. There are no travel cases in these 7 cases. Contact investigations have begun to identify and isolate anyone who may have been in close contact with these new cases. Today's news is both troubling and expected. We know COVID-19 is in the United States and in Oregon. COVID-19 is a communicable disease. We know it will spread. We know we will see more cases. But we also know there are steps we can take to prevent COVID-19 transmission and protect people most at risk: older adults, people with underlying medical conditions, people who are homeless or face other barriers to medical care and services. All of us have a role to play at work, at home, and out in the community. By taking effective evidence-based action, we can slow the spread of COVID-19, protect people who are most vulnerable, and deny the virus the opportunity to cause widespread disruption to our daily lives. The Oregon Health Authority continues to take action to fight the spread of COVID-19 in the state. The emergency powers Governor Brown has authorized today will give us more freedom and flexibility to contain the outbreak and protect Oregonians. Here are some specific actions we're taking. We're expanding testing. OHA is finalizing agreements with major hospital systems to expand COVID-19 testing and expand locations where COVID-19 tests can be conducted safely without creating avoidable exposure risks for other patients and the healthcare community. We are prepared to activate volunteers who are trained and licensed medical professionals who can augment services available in local areas, particularly rural communities whose public health resources are stretched thin. We're expanding telemedicine. I'm using my emergency authority to give health systems, insurers, and coordinated care organizations greater flexibility to expand telemedicine in Oregon. Telemedicine is an effective way for healthcare providers to screen, evaluate, and treat patients who may be worried but well, mildly ill or at risk, without coming into a clinic or hospital emergency department and exposing other patients and healthcare workers to potential illness. I'm convening providers who serve older adults and other vulnerable populations to mobilize an aggressive outreach and prevention strategy to protect the people who are most at risk. And finally, more funding. Tomorrow, the legislature will consider an emergency $5 million request for funds to fight COVID-19 in Oregon. We will continue to assess our need for resources to support Oregon's strategy to contain, protect, and respond to the needs of Oregonians who face the greatest risk from COVID-19. Finally, let me say this. In Oregon, we have many strengths and tools to be able to fight the spread of COVID-19. A passionate and well-coordinated public health system, effective and aligned healthcare providers, higher rates of healthcare coverage than most other states, which give 94% of Oregonians the ability to access medical care, paid sick leave laws that give people in Oregon the ability to stay home if they're ill and protect coworkers and others in the community. However, we cannot combat COVID-19 if we turn on each other. COVID-19 does not discriminate. That only puts sick people and the broader community at risk because it discourages people from seeking the help they need, from getting tested, from getting care, and staying at home. We cannot shun and stigmatize people who test positive or become ill. We must join together to take science-based actions that protects those who are most at risk and minimizes unneeded, counterproductive disruption in our community. Now I'd like to turn the podium over to Dr. Dana Harganani, Chief Medical Officer for the Oregon Health Authority. Dana.
Thank you, Director Allen. I'm Dana Harganani, Dr. Dana Harganani, Chief Medical Officer at the Oregon Health Authority. I'm also a practicing pediatrician and a mother of 3. I know people across Oregon are concerned about COVID-19. Today, I want to tell you the latest information we know about the cases Director Allen has mentioned. So what do we know? Yesterday, the Oregon State Public Health Laboratory identified 7 new presumptive positive cases. That brings the total positive cases of COVID-19 to 14 in Oregon. The location of those include 1 case in Douglas County, 1 in Marion County, and 5 are from Washington County. 3 of the cases were hospitalized at the time of diagnosis, and the remaining 4 cases experienced mild illnesses and symptoms and are recovering at home at this time. None of the new 7 cases are related to international travel. 4 of the 5 new cases in Washington County are related to contacts of previous identified cases. The remaining 3 cases are being considered community acquired. So what do we know about the risks of COVID-19 for Oregonians? What we do know is that most people who get COVID-19 are going to experience mild symptoms. We know from data collected nationally and internationally that most people who contact COVID-19 experience symptoms similar to the common cold, a cough, a runny nose. This week, the Center for Disease Control identified a set of population who are going to be more at risk. Those include older adults, people who have severe and chronic medical conditions like heart, lung, or kidney disease. We also see from the earliest data that those older people are twice as likely to have more severe disease than others. So how can older adults and people with underlying chronic medical conditions stay safe and healthy? First, the recommendations are to minimize contact with people who may be ill and try to avoid large public gatherings. Ensure that you have prescriptions at home to last you for a while. Consider mail order. Also, just continue to take common daily precautions. Wash your hands frequently, don't touch your face and eyes, and clean surfaces. As Dr. Allen mentioned, we're focusing on our testing capability. The Oregon State Public Health Laboratory is beginning to run low on certain components, but we are looking at resupplies from the CDC and working with our state partners to the north. Also, as Director Allen noted, we are working with hospitals to bring more testing capacity online as soon as possible. We know we can all work together to reduce the spread of COVID-19 in Oregon and continue to protect the most at risk. Thank you.
Hello, I'm Dr. Bob Dannenhofer. I'm the Public Health Officer from Douglas County. Douglas County was notified last night that we have a single presumptive case of COVID-19 in Douglas County. I'm pleased to report that the patient is medically stable. Thank you.
Good morning. My name is Katrina Rothenberger. I'm the Public Health Division Director for Marion County Health and Human Services. Marion County has one presumptive positive of the novel coronavirus, COVID-19. Our thoughts are with the affected individual and family. The health and well-being of Marion County residents is our #1 priority as we respond to the needs of our community. Public health staff are working through the weekend to identify close contacts to the individual. The Marion County case had no previous contact with other confirmed cases and is suspected of being community acquired. Most people with COVID-19 have mild symptoms. If you are feeling sick with mild symptoms and do not need to seek medical care, stay home while you recover. If you are sick and plan to seek care, please call before going in for care so arrangements can be made to prevent exposing others.
Hello, everyone. My name is Dr. Christina Baumann. I am the health officer for Washington County. As you heard, Washington County has 5 new presumptive cases of COVID-19 illness. 4 individuals were identified through the public health investigation. The 5th does not appear to be related. Washington County continues our work to identify close contacts to these new cases. I want to underline the point made by our colleagues that COVID-19 can present as a mild illness. We want people to take this seriously and take measures to protect those that are most vulnerable. So we ask you, if you have any illness symptoms, please do not visit people in hospitals. Please do not visit your loved ones in long-term care facilities. Protect those who have chronic medical illnesses and who are older. We thank you for participating, helping, caring, and we will continue to work as public health to do what we can, and we ask you to also please do what you can. Thank you.
So, question?
Can you give us the age ranges of the people that were mentioned today?
Yeah, thanks. The question was, can we provide the age ranges? We'll be providing the age ranges as part of the tabular information that we'll release, that we update to the website, which should be shortly if it hasn't already occurred.